Welcome to Module 5 of the Cancer Toolkit. This module is going to cover lung cancer awareness. Please ensure that you've completed all the previous modules before starting this one. The aims of this module are to increase awareness of what lung cancer is, understand how it is diagnosed and treated, learn about the possible signs, and increase awareness of the walk-in chest X-ray clinic that's available in Leeds. The four main common cancers in the UK are prostate, breast, lung and bowel. So what actually is lung cancer? Well, lung cancer starts in the windpipe, or very commonly starts in the windpipe, the trachea, the main airway, bronchus, or the lung tissue itself. And the cancer that starts in the lung is called primary lung cancer. And there are two main types of primary lung cancer. There's non-small cell lung cancer and there's small cell lung cancer. The most common type is non-small cell lung cancer. The treatment you need depends on which type you have. And if cancer spreads to your lungs from somewhere else in your body, it is called secondary lung cancer. So who gets lung cancer? Lung cancer is more common as you get older. 45 out of 100 people, so 45%, are diagnosed with lung cancer in the UK are aged 75 or older. And in the UK each year, around 25,400 men are diagnosed and around 23,800 women are diagnosed. And more than 60 out of 100 lung cancer cases in the UK, well, more actually than 60%, are caused by smoking. So how's it diagnosed? Well, usually start by seeing your GP if you have symptoms that could be due to lung cancer. They will ask you about your general health and may also examine you and ask about lifestyle, etc. And your doctor will then decide whether to do tests or refer you straight to a specialist. You usually have several tests to check for lung cancer. This might include all or some of the following. So you may have a chest X-ray. They may carry out CT or MRI scans or a bronchoscopy, which is a camera that goes down into the bronchos, down into your lungs. You may have ultrasound scans and they may wish to carry out biopsies. So how do they treat it? Well, very similar to a lot of other cancers that have been discussed during these modules. It may be a combination of chemotherapy, radiotherapy, surgery, chemo and radiotherapy, radiotherapy to the brain. It will all depend on what they find and how they want to treat it, because no two cancers are treated exactly the same. All of them will be tailored to whatever the team of healthcare professionals think is best for that patient. And sometimes they'll use targeted cancer drugs. So any of these things can be used, or a combination of them. Now, the kind of signs and symptoms that we're looking for are things like having a new cough or a cough most of the time. And you can still feel fine. You don't have any cold symptoms. You don't feel under the weather. It's just a little annoying cough. And you may notice this in other people. You may notice that they're coughing often and have been doing for weeks now. So we want to find out what that's all about. Getting out of breath doing the things that you used to do without a problem. So some people will say, they go upstairs and they sit on the top step and they're out of breath. Or they've got back from carrying some shopping and they've put their bags down and they need a little rest before they put the shopping away and things. If you're ever coughing up phlegm with blood in it, that's a red flag. We would want to know why that was. Or having an ache and pain in the chest or shoulder that isn't going away. This is something that's been hanging around for a few weeks now. Or chest infections that keep coming back, or a chest infection that doesn't get better. Also, a common symptom in lots of cancers is losing your appetite. And this ties in with another symptom, which is losing weight. But it isn't like losing weight when you decide to diet and get healthier. It's an unhealthy losing weight because muscle mass is also lost as well. And feeling tired all the time, and unusual fatigue. So people often say, they just could drop off at any time. They just want to go to sleep pretty much throughout the whole day. It's not just that you've had a long day and you're tired at the end of it. It's that you feel an unusual tired throughout the day. Also in Leeds, we have this fantastic service, this Got a Cough, Got a Check, whereby if you've had any of the symptoms on this side of the slide, like a persistent cough or shortness of breath or coughing up blood or a change in a voice or a lump in your neck or the unexplained tiredness, you can go to one of these walk-in chest X-ray clinics that are at the LGI, Seacroft Hospital, St George's Centre in Middleton, Wharfdale Hospital, St James, and you just walk in. You have to be over 40 and registered with the Leeds GP, but you can just walk in and have a chest x-ray, and they will send those x-rays to your GP. So it cuts out the middle appointment of having to see your GP first. It's a fantastic system. I've tried it myself to see how effective it is, and I was in and out in 15 minutes. So I really would encourage you to either go yourself if you're concerned, or encourage people that you may be concerned about. I'll maybe have to go along with them and just use that service, because it's fantastic, really. We're very fortunate to have it. There's also a big research project happening in Leeds. You may have seen the vans there that are pictured in the slide, whereby they are calling up smokers and former smokers to carry out early lung x-rays. You can't just step onto these buses. They're not the got a cough, got a check sort of access. You have to be invited for an appointment to these buses, but you'll sometimes see them in places like supermarket, car parks. And so far, since 2018, there's been 340 lung cancers diagnosed as a result of this research. So it really is proving to, provide dividends on that. As usual, these are some reliable sites that you can access if you want informed information, further information about cancer. So we've got Cancer Research UK, Asthma and Lung UK are very good, the NHS, our own website, leedshealth.co.uk, and also Macmillan. This now completes Module 5 of the Cancer Toolkit. Please ensure that you complete the assessment before moving on to the next module. Thank you.